We are living in a very interesting time in which something which we thought cannot be possible is possible today. So can you imagine a patient coming in the morning, a patient who has a 3 centimeter brain tumor, and the patient gets treated in 40 minutes and goes back home. So this is the kind of revolution that technology and imaging is giving us today. I am Dr. Aditya Gupta, Chief of Neurosurgery at Artemis Hospital in Gurgaon. And what we are talking about today is a very advanced technique called CyberKnife Radiosurgery. So radiosurgery is a very interesting discipline in which we shoot a very high dose of radiation, but very, very precisely at a limited volume in the brain or actually anywhere in the body. My own personal work is related to the brain and the spine. And in CyberKnife Radiosurgery, what is also a very, very elegant thing is that we do not need to put a frame on the patient's head, which used to be the case until a few years ago. So without any pain and completely non-invasively, using the CyberKnife, we are able to focus multiple beams of radiation on the tumor and deliver a very high lethal dose of radiation to the tumor, which kills the tumor cells all in a matter of 40 minutes. And the interesting part is there is no downtime. The patient comes from home, we take the patient on the couch, and the patient lies comfortably with a mask on the head, which is again very comfortable and very easily tolerated. And all this time, we are very closely monitoring the position of a patient in space in real time to the accuracy of 0.1 millimeters and 0.1 degrees of angular displacement or rotation. This is made possible by very fine quality X-rays that are able to determine the position of the patient, and the radiation delivery keeps on taking place simultaneously, sequentially, one beam after the other. So in 40 minutes, typically we would deliver something like 180 or 200 individual beams of radiation. And in 40 minutes, the patient is ready to go home. And I sometimes joke with my patients that you actually don't need to take a day off. You can get the treatment done and go back to your work right away. Having said that, this treatment is very easily tolerated and it has excellent results. If we choose the tumor carefully for a CyberKnife procedure, then there are almost 99% chances that this tumor will respond to CyberKnife radiosurgery. So that is something which needs to be handled with care, because not all brain tumors are actually good for CyberKnife. But what we are finding is that the vast majority of patients that do come to us with small sized tumors can be treated with the CyberKnife and treated non-invasively.